Ladies and gentlemen, dear Julio, it's a great pleasure and honor indeed to give the laudation for Professor Julio Palmaz, a great inventor in interventional radiology and vascular medicine. Professor Palmaz, he was born in La Plata, Argentina, and he also made his medical degree in La Plata. And then he moved with his family to the United States, California, where he stayed for 6 years. And finally, he moved to San Antonio, Texas. The reason to go there was that there were ideal experimental facilities, and he was very interested in experimental work. There, he was working on the development of an endovascular implant, a stent. And so he developed the balloon expandable Palmaz stent. He firstly presented his experimental work with his balloon expandable stainless steel stent at the RSNA in 1984. I remember this very well because I was at the same session and presented my endovascular laser work, which by the way was not very successful and was terminated a few years later. But his invention, of course, was a tremendous success. The funny thing it was a very small session where only probably the 5-6 presenters were at the sessions, and therefore when he first presented his work, almost nobody could hear it and hear what great invention has been done. He finally patented the balloon expandable stainless steel stent in 1985 and sold it to Johnson & Johnson. The first implant in man was done in Freiburg, Germany, together with Götz Richter, and the first publication of the implantation in man was done 1988 in radiology. Professor Julio Palmaz also knew the potential of his balloon expandable stent for other applications. Together with Dr. Schatz, a cardiologist, he also developed a coronary stent, which is an angulated stent. And this was also very important because recoil and rethrombosis after balloon angioplasty in the coronary arteries was a very dangerous complication, and therefore the stent was very important to improve the result of coronary angioplasty. He created the tips, so the stent shunt, and this stent shunt is nowadays the therapy, the first-line therapy for patients with ascites and for patients with esophageal variceal hemorrhage. And together with the Argentinian vascular surgeon Juan Parodi, he did the first implant in a patient with an abdominal aortic aneurysm. He was introduced in the National Hall of Fame, and his invention of the balloon expandable stainless steel stent was recognized as one of the 10 most important inventions of the last century. He now runs a vineyard in Napa Valley in California, together with his family, his wife Amalia, and his 2 children. And they produce excellent Cabernet Sauvignon and Riesling wines. Once when I visited him in California, I had the opportunity to taste them, and they're really exceptional. Professor Julio Palmaz is always looking for something new. Whether these are new stents, whether these are new applications such as tips and endovascular treatment of abdominal aortic aneurysm, or whether this is development of excellent wines in Napa Valley. Dear Julio, it's now a great pleasure to present you the Gold Medal of CIRSE for 2021. We are very proud to have you as a gold medalist in CIRSE.